Jon Rappoport in San Diego, sitting in for Alex Jones on The Alex Jones Show. We're talking medical murder. We're talking medical cartel. We're talking about a globalist agenda to make you a patient in the system from cradle to grave and dose you with toxic pharmaceuticals, debilitate you and your children and the population all the way down the line to make you more malleable and easy to control. That's the agenda, folks, in a nutshell. What the medical system has done is taken the aspects of itself that produce good results. For example, emergency crisis trauma medicine. You know, you're lying on the street and you've been run over by a bus. Well, somebody comes along with a glass of, with herbs in it, as opposed to the guys, paramedics, and they want to take you to the hospital and they put you back together again. You're liable to say, let's go to the hospital, folks. But they parlay that, you see, into saying that everything medical is just as good as we can do in putting you back together after you've been run over on the street. Everything is just as good. Long-term treatment for chronic diseases and treatment for brain problems and cancer and heart disease and all of this, and prevention and vaccines and so on and so forth. It's all just as good as we are good at putting you back together after you've been run down on the street. That's their angle. That's their play. That's their con game. That's their shell game. You just heard Dr. Peter Breggin, one of the brilliant lights in the field, talk about what's happening in the military now, where people, kids who want to go to war, are being told, you can't go to war unless you'll take the psychiatric drugs. The drugs that have been shown time and time again by Breggin and others to cause violent, erratic, suicidal, homicidal behavior. You want to see the relationship between Prozac and the other SSRI antidepressants, Zoloft, Paxil, and so on, to violence and violent behavior and other long-term debilitating effects? There's material all over the place, and at Breggin.com you can find much of that. Okay, we're talking about Robert Bale, the sergeant who is now accused of killing 16 civilians in Afghanistan. You heard Dr. Breggin talking about the pileup of effects here, from PTSD to the fourth deployment, and also he brought up a fantastic point about how, because he's handling some of these cases, Dr. Breggin, a soldier during the day is being used to go into a village and help reconstruct a village. And yet the soldier knows that at night, some of the same people in that village, he doesn't know who, are going to turn against him because they really are Taliban, and they're going to try to kill him. This is a way to fight a war? I mean, I'm laughing because what else are you going to do? I could scream. This is a way to fight a war? This is not a war. This is an operation to gain control of resources, as we are seeing with AfricaCom, all over the world where America and other of its allies are intruding. This is about natural resources. It's about rare earth minerals. It's about oil pipelines. It's about domination of the populace. And under that heading, what has been left out of the equation, even in much alternative news, under the heading of debilitation of the population, is the ultimate agenda of the medical cartel. And I'm showing you here, step by step and degree by degree, and we've got a lot more to go, is that this is, in fact, debilitating and destructive to you, your children, and the population. Jon Rappoport here for Alex Jones. Don't go anywhere. We will be back.
Everything we said came true. Everything we've done has been right.
Here sitting in for Alex Jones today on The Alex Jones Show, referring back to Dr. Breggin's comments about the dangerous effects, the violence-inducing effects, for example, of certain psychiatric drugs and how widespread they are in the society. You want to demoralize the society? You want to put people into a state of fear, confusion? You want to debilitate a society? You want to produce an operation like that that makes the society in the long run easier to take over by those elite forces who want to take it over? There's the formula. You plant seeds, folks. You plant seeds everywhere of these and other toxic drugs, some of which induce violence. And you stand back and you say, let it roll. Let it roll, boys. Let it roll. And you watch what happens. And things become more and more and more bizarre in that society. Weirdnesses pop up in the press of strange stories of people running naked out onto the street and killing other people unexplainably. What is all this about? And nobody knows. The press doesn't want to say. The press doesn't want to cover it. The press doesn't want to investigate. What I'm telling you is that's the formula. You put enough of these pharmaceutical drugs into a society, and that's what you will get, and that's what we are seeing. And here I will give you the proof right now. Okay? Screw in your brains real tight on this one. Barbara Starfield, doctor, Johns Hopkins School of Public Health. The year 2000. The Journal of the American Medical Association. So far, the credentials are pristine. Mainstream, conventional medicine, perfect credentials. July 26, 2000, Journal of the American Medical Association. Starfield writes a review called, "Is U.S. Health Really the Best in the World?" And in it, she concludes the following. That in the United States every year, the medical system kills 225,000 people. 119,000 of those in incidents and events related to hospitals, and 106,000 a year, like clockwork, deaths every year in the United States from FDA-approved pharmaceutical drugs. Drugs approved by the FDA as safe and effective. Killing 106,000 people in the U.S. like clockwork every year. And if you care to add that up, you will see it comes to more than 1 million Americans per decade killed by FDA-approved and certified pharmaceutical drugs. Okay? Chew on that. Chew on that. Chew on that. Perfect, insider, mainstream, conventional, down the middle of the road credentials, the author, the medical journal, the publication, and that's the report. In the year 2000. Every year, FDA-approved pharmaceutical drugs kill 106,000 people. In the United States. Not even talking about maiming, we're talking about killing. And the medical system on the whole kills 225,000 people a year. Like clockwork in the United States, that would be 2.25 million people a year. I mean, a decade. 2.25 million people a decade. You want to use the word Holocaust? You want to use the word genocide? Medical treatment is now the third leading cause of death in the United States behind heart disease and cancer, and has been at least since the year 2000 when this was published. I've been broadcasting this fact all over the world for the last, 5 years. I interviewed Dr. Starfield, one of the last interviews she did before she died in 2011. I said to her, after you published your article in the year 2000 and cited those statistics, did anybody from the FDA ever contact you for assistance in trying to correct the situation? This was an email interview, and she wrote back, no, in capital letters, N-O. Anybody from the government get back to you and say, we need your help, we have to fix this? No. Are you aware of any efforts, remedial efforts, by the government After all, it's the FDA, which is an executive agency of the federal government, that says these drugs are safe. Any effort that you know of by the government to fix this? No. No. Did your paper, when you published it in the Journal of the American Medical Association, receive any overwhelming criticism? No. It was given, in a sense, the silent treatment. There were stories in the media at the time, but they went away eventually. Starfield, over the years, continued to get at least, she said, one request a week for a copy of that paper. But the media were absolutely silent. And we'll get to the reasons why. Of course, we know all about advertising revenue from pharmaceutical companies. Yes, yes, yes. But there are deeper reasons for media silence on this. Because when you think about it, this is a gigantic story. Even just from the story point of view. I'm a reporter, okay? I know a story when I see it. You know a story when you see it. This drives me crazy. This drives me crazy. If the New York Times or the Washington Post or any other major U.S. paper that is, in fact, going down the toilet, and they are, wanted to resurrect their species on this planet, all they would have to do is climb on this story that I'm feeding you here right now. Over 1 million people per decade killed in the United States by FDA-approved pharmaceutical drugs on an ongoing basis. You don't think that that story could be run 3 or 4 times a day in print editions on newsstands with interviews, doctors coming out of the closet admitting, I knew, and I did nothing, and I feel so horrible now. And FDA people saying, I tried to warn the head of the FDA that this was happening. He wouldn't listen to me. I was sidelined. The president saying, I don't know anything about this. All manner of people emerging out of the woodwork. I can look into the future and see this story playing out in unbelievable ways over the next 3-4 years. You could pound on this sucker every day in a major newspaper like the Washington Post would make their Watergate investigation look like looking into theft in a candy store. Every day, new information, new things come out, new people talk, new doctors show up. And on top of this, you see, doctors are claiming, we don't know anything about this. Your medical doctor is saying, hey, I don't know anything about this. I can't believe this couldn't be true. As you sit there and say to your doctor, hey, by the way, Sam, I just want to let you know that there's a paper that was published on July 26, 2000, in the Journal of American Medical Association by Dr. Barbara Starfield that stated in no uncertain terms that FDA-approved pharmaceuticals kill 106,000 people a year in the United States every year. Oh, that's ridiculous. If that were true, I would have heard about it. Yes. Really? Is that so? Is that really so? Are we willing to accept that excuse from doctors anymore? I don't know. Let's suppose that you were, I don't know, a cab driver in New York City, okay? Here's a good analogy for you. We're getting down to it, folks. 106,000 people a year killed in the United States every year by FDA-approved pharmaceutical drugs, and a total of 225,000 from all effects of the medical system. Third leading cause of death in the United States, not being explored by the media. You want to know what pharmaceutical and medical warfare staged by the cartel against the global population is all about? And we're not even talking about debilitation or maiming or mutilation here. We're talking about DEATH, death. And I'm citing the authoritative paper on the subject, okay? It's warfare against the population to destroy and debilitate the society, to make it more controllable and easy for takeover. And there are people at the top of the medical cartel who know very well what they are doing. Everybody else is playing along for whatever their reasons. And if anybody comes up to you and says, well, you can't have a conspiracy unless you would have thousands and thousands of people that know about it. Baloney. Everybody plays his part for his own reasons. That's how you get a conspiracy. Only a few people really have to understand and know. Of course, there has to be a lot of lying that goes on, and I'll be talking to you about more of that later. But anyway, you're driving a cab in New York City, and a guy gets into your cab and says, take me uptown to Times Square. And he says, by the way, have you heard about the cabbie down in the Village that mowed down 6 people this morning? You say, gee, no, I haven't. You really? And he said, not only that, but up in the Bronx, there was a cabbie that drove his car with 3 passengers out of some kind of a parking garage 16 stories down to the street. And there was another cabbie over in Staten Island who started shooting people. And this all happened when you say you're the cabbie? This morning. This morning? Yeah, this morning. Why don't you know, Mr. Cabbie? We'll find out the answer to that question and what it has to do with medical death in America when we come back. This is Jon Rappoport sitting in for Alex Jones on The Alex Jones Show. Don't go anywhere. Jon Rappoport sitting in for Alex Jones on The Alex Jones Show. Before we went to break, I was just talking about a story which I'll telescope here. If you were a cabbie in New York City and you suddenly learned that there were cabbies all around you committing violence, you would be aware of it. People would let you know, even if it wasn't in the newspapers. And so if you say that doctors don't really know that the medical profession via pharmaceuticals is killing 106,000 Americans a year, they don't know, they're not aware of it, they're entirely innocent. Come on, come on, come on, come on. Okay, we've got more on that later on. But Sweden is in the news, folks, because guess what they're doing? They're going to eliminate cash. Isn't that wonderful? They're moving into a cashless society. Apparently, they've been ruthlessly getting off of cash for years and years. I think they're down to about 3% of all transactions now involve cash. And now they're saying, hey, let's eliminate it altogether. Why? Cost of printing. Oh, yeah, gee. And people scratch their heads and they say, oh, yeah, that sounds great. Because a society should first of all think about the cost of printing. This is the most important thing in the universe, is the cost of printing money. And if we can eliminate that, it doesn't really matter what we do, right? This is the way they're presenting this. Completely absurd, right? And the other thing is, we'll eliminate bank robberies and cash robberies. Oh, yeah, sure you will. Absolutely, because there'll be no cash around. But at the same time, the cybercrime rate will skyrocket. So this is a completely bogus cover story. What they're moving toward is a cashless society for one reason, so that the government and the forces of supernatural government, globalism, can control money and control your money. They know what you spend, everywhere you go, what you do, where it goes. Ha, ha, ha. They've got you. They've got you. That's what a cashless society is all about. That's why Sweden is in the forefront of this, because they're basically saying to the world, you're going to catch up to us soon. We're in the vanguard. This is progressive. This is wonderful. Yeah, it's wonderful if you want the government to be able to say that you spent 3 cents in Dubuque, Iowa on New Year's Eve, and they got it tracked exactly, because that is, in fact, what is going to happen. And I'm not being paranoid, I'm being very factual. That's what the system is for. Now, speaking of prices, of course, gas prices are going up through the roof, which is exactly what Obama wants. Oh, did I say that? Because he said, why would I even think of running to be elected if at the same time I were forcing up gas prices? That's ridiculous. No, afraid not. Ever since the Arab Spring broke out in Egypt, I've been writing and telling people, you know, folks, this has a lot to do with the price of oil. Don't forget that. This has a lot to do with the price of oil. For everything else that it has to do with, including domination of resources and people and so on by globalist invading troops and terrorists, thugs, it has to do with the price of oil. In raising the price of oil. Because the price of oil is dependent upon, quote, perception about oil, which in turn is regulated by what media says about perception about oil. Yeah, it's that insane. Oh yes, the price of oil is going up again today because obviously of the turmoil in the Middle East. I saw these headlines on and on and on. What turmoil? No straits or canals were being threatened. Nothing was happening. But there was enough of an appearance, you see, of turmoil to start the ball rolling. And that happened in Egypt, and it's been going on ever since. And now we have the threats. We'll cut off the canal. We'll do this. And the price keeps on rising. And why is this part of Obama's agenda, which is to say simply the globalist agenda? Because Obama, Bush, whoever, Clinton, doesn't matter. This is the globalist agenda because, of course, we can move into Greenville and Green City. We can now say, well, guess what? We've got all kinds of alternative energies now, like windmills that we can set up everywhere that are suddenly cost effective because now that it costs $10 to buy a gallon of gas at the pump, well, you could blow through a tube in your house and produce energy that would be useful because it costs $10 a gallon at the pump. This green agenda includes cap and trade, includes all of this that is going to destroy industry worldwide. This is Jon Rappoport sitting in for Alex Jones. We'll be back with more on this after the break.
Ask yourselves, what are you doing in this time of great challenge? What are you doing to unlock minds?